the brain sends a message down the spinal cord. The spinal cord sends a message to the nerve. The nerve controls every function of the body. That's page 4 of Grey's Anatomy, right?
Yes.
That the nervous system controls it and coordinates every function of the body. And then at the end of their plan, I take post x-rays so that we can see the change. Because It's exciting. Patients are like, man, I feel so much better, but it's exciting to literally see the change. So yes, you can feel the disc. You can, even if you get a sliver of disc space, then the nerve can heal and repair.
Welcome back, everybody, to the Healthy Habit Podcast. I'm your host, Dr. Dayan of Healthy Habit Medical Center, located right inside Healthy Habit Health Foods. And our favorite chiropractor in town is back, folks. We are talking here in episode number 104 with Dr. Roxane Zamora. Thank you for joining us here, Dr. Roxane Zamora, Doctor of Chiropractic Medicine. She's been in practice in North Phoenix at the same location for 14 years. Dr. Zamora provides chiropractic corrective care and car accident care for all ages. And you can find her at Imagine Wellness Chiropractic in North Phoenix. And the number for her clinic there is 623-582-8951. That's 623-582-8951. And I'll share all that in the description box below this video. Dr. Zamora, welcome back.
Yeah, I'm glad to be here. I always love talking with you, and I love your folks.
Likewise. Well, people are already enjoying going to see you and listening to you here on the podcast. I've already been sending patients to Dr. Zamora up in North Phoenix because I know that this is a fact, that we all need chiropractic care as part of our preventative medical model. Why do you think that? Why do you think everyone should have it as part of, like, how they go to their dentist, their naturopath for their preventative blood work? Why do you think everyone should have a chiropractor on board for prevention?
Well, one thing, every time you're getting adjusted, it boosts your immune by 200%. So that's a factor right off the bat. If you want to improve your overall immune system, it's important to get adjusted. I'll show you really quickly why that is too. And some of you may already know this, but how the body works is the brain sends a message down the spinal cord. The spinal cord sends a message to the nerve. The nerve controls every function of the body. That's page 4 of Grey's Anatomy, right?
Yes.
That the nervous system controls it and coordinates every function of the body. And what houses and protects the nervous system is the spine. So that's how your heart beats, your lungs breathe, your stomach digests. You go to the bathroom. Low back for women is fertility, their periods, their hormones. For men, it's prostate, ED issues. So that's how we stay alive. Everything functions. Now, the problem is if the bone misaligns or the disc starts to degenerate, that's called subluxation. So if there's subluxation in your body, research tells us a feather's weight of pressure on a nerve decreases the function of that coordinating organ by 50% within minutes.
Wow.
Yeah. And so you want your nervous system to be free flowing, adapting, and that's, we have to look at the spine. So looking at the spine, because spine controls nerve, nerve controls organ. So if you got a spine and a nervous system, you want to get checked. And so that's what I check for, because I do corrective care. So I look at the spine. From the front, we want it to be straight because we know scoliosis is bad. And that's why it's bad, because if there's a feather's weight of pressure on the nerve, then disease is building. So we know that.
Yeah.
Why we evaluate for it and check for it. And then when I look at the spine from the side, you want to see a curve, curve, curve. And so I also analyze that with x-rays. And what I look for is, here's a normal curve. I compare yours, all of my patients to normal. And then look for what phase of degeneration if they're not in a normal phase. So phase 1 is the curve goes straight. And that's typically from a sports, being in the military. Now we have text neck, right? Everybody's looking on our computer. It's pretty prevalent. Even really younger kids from car accidents. The curve can go straight. Well, now the problem is it will heal straight and then put pressure on the nerve, and then we know there'll be some disease building here in the organ. If it's not corrected in phase 1, which it is treatable in phase 1, then it degenerates into phase 2. So now this disc is really narrow, degenerative disc disease, either herniated, desiccated, some kind of damage and degeneration in the disc.
Wow.
And that's phase 2. And that's when also arthritic spurs build up and start to develop. And this is typically when people are seeking out something, right? They're starting to get on medications or supplements because there's something going on here.
Yeah.
And it's not going away like it used to. So there are people before like, 5 years ago, I got adjusted once or twice and it was gone.
Right.
I was like, well, that's also 5 years ago. Right?
Exactly.
It's been degenerating since then.
Yeah.
And then, so if it's not corrected in phase 2, it will continue to degenerate into phase 3 where it fuses together. And I tell people it's kind of like this. You get a toothache, right? If it's almost similar physics to a tooth. You get a toothache. If it isn't corrected, it goes into a cavity, right? If you don't work on the cavity, it turns into a root canal. It's the physics of the body. It will continue to degenerate if there's not some type of intervention. And so that's why I start with x-rays for everybody. What phase of degeneration are you? What organs are starting to build disease and being affected? And then how do we correct that as much as possible? Because even if somebody is here in phase 3, the body will still try and heal and repair as much as possible. So even if you're in phase 3, it's not, there's still hope.
It's never too late.
Yes, never too late.
So I've seen people come to our clinic even with their x-ray and MRI showing bulging discs or stenosis of the spine. Can chiropractic still help if it's already at the point of bulging discs? What would you do? Like, what are your thoughts in that case?
So what I do is try, if we can't get the structure where it needs to be, it's going to continue to degenerate no matter what you do. I say it's similar to this. If I sprain my ankle and I keep walking on it sideways, let's say I twist my foot and I'm walking sideways on it, my ankle's always going to be swollen. It's going to continue to hurt. And there's going to be arthritic changes in there because I continue to aggravate it, right? It's not properly aligned. So if I get my foot where it needs to be, then it can start healing. The joint space can heal, the tissue can heal. Now it can start healing. And so it's similar with the spine. I have therapies here that help the disc heal because you can heal the disc. And I always take pre and post x-rays. So I start with x-rays at the beginning of a treatment plan. And then at the end of their plan, I take post x-rays so that we can see the change. Because it's exciting. Patients are like, man, I feel so much better. But it's exciting to literally see the change. So yes, you can heal the disc. You can, even if you get a sliver of disc space, then the nerve can heal and repair. So even if we can get a sliver of disc space, the body will heal.
Wow.
So the goal is definitely heal the disc space, get the structure back, as structure controls function in everything in life, right?
Interesting.
If we build a house and the foundation isn't proper, everything's going to fall apart.
Wow.
It's similar. You have to get the structure back where it needs to be. If the pelvis is shifted, we need to level out the pelvis, because if the pelvis, your hips are out, then it's going to affect your knee, your ankle, your foot, right? It's just going to keep continuing. So you want to, I always start with x-rays. Where's your structure? let's get the structure better. Then the disc can start healing. The tissue, usually inflammation starts going down right away because it's not as aggravated. When I use the analogy of the sprained foot, it's always going to be inflamed because it's always aggravated. So the inflammation starts going down right away. And then it starts healing properly where it needs to be.
Wow, that's phenomenal. So after the adjustment, the spine gets back into proper alignment, and then that takes pressure off the disc, and it's able to slowly start getting back into its normal position, right?
Yes, it starts healing and repairing. Yeah, and so that's what we do because, and I like to tell people it's not a quick fix in my office. But the changes are miraculous. I had on your 12th visit, I do a re-exam with everybody, check in, how's the body adapting. And I had a woman today tell me that she's had IBS for 30 years and it went away since she's been getting it.
That's
she
interesting.
Said, it's a miracle. She's like, I didn't even expect that. And a lot of people don't always expect. They come here for pain, right?
Yeah.
And I understand that, but they don't understand that this controls this, right? And then once I explain that, then they start seeing like, oh wow, yes, my IBS went away and I had it for 30 years.
Yeah. So that's almost the same. That's almost the same picture I have here on my wall, but it's covered with this image right now. But I'm out in Sedona here in the middle of nowhere on a hike, and I'm doing a podcast. No, just kidding.
Oh,
it's not real. But I have that autonomic nervous system picture here on our podcasting wall here, and it's same as that. Yeah. It shows you the nerves feeding all the different organs. Yes. So imagine if there's impingement there at the spine. And that's kind of like where we left off last time we had Dr. Zamora here on episode number 94. If you missed that episode, head over to the Healthy Habit Podcast on YouTube or on Spotify and check out episode number 94, where we talked why you may need a chiropractor with Dr. Zamora. And one thing I wanted to ask is, we finished off talking about what would you look for on an x-ray. So you mentioned a little bit about that here today. Are you doing a full 360 view of the x-ray, just the front and the side, or what are you looking for exactly? How do you do those?
So the A to P is what we would take here, the front, because I look for scoliosis. And I also look at the hips. Are the hips aligned? Are they shifted? And also, is it rotated? Because sometimes when I take x-rays, it will look like one hip is much wider and one is narrow. And it's not that you're typically not born with one wider and one narrower. It's that when the pelvis rotates, you see more of one than the other. So I look for rotation in the pelvis if they come in for low back. And then I take one from the side, so the lateral view, and that's when I look for the curve. So I look for the curve. I look for the phase of degeneration, like the disc space.
Okay.
Where they're at, and then what organs are being taken. So usually I take one from the front and one from the side so I can see both. Is there a scoliosis, rotation of the pelvis?
Yeah.
And then also this first bone here, I look at the atlas. C1 is the atlas. I look at that one because if your curve goes straight, that first bone pushes up, and it literally pulls the brainstem down, and then there's pressure on your brainstem. And that's when, because if you can see this, how close the brain is to that first bone. So literally the curve goes straight, then the spinal cord stretches, pulls the brainstem down. That's when people can have headaches, migraines, anxiety, depression, some kind of OCD issues. And so we have to get the curve back so that then the brain can go back up where it needs to be, take the pressure off, the atlas off. So I always analyze, if you're coming in for cervical spine, like your neck, I always look at where is the atlas because of its importance to the brain. And we know atlas is, remember in mythology, Atlas held up the world.
Yes, on his back.
That's why it's nicknamed Atlas, because importance to the overall body. And when chiropractic first started, they only adjusted the atlas.
Wow.
because of its importance. But and then through some people still only adjust the atlas. I like to adjust full spine, but so I look at the atlas. Where is the atlas, and its relationship to the brainstem as well. So those are the X-rays that I take is A to P, which is the front to back, and then lateral from the side, so I can see where is their structure.
Folks, it's episode 104 here on the Healthy Habit Podcast. We're talking with Dr. Roxane Zamora, Doctor of Chiropractic Medicine at Imagine Wellness Chiropractic up in North Phoenix. And I suggest you go check her out, folks. It's time to start putting chiropractic medicine on your radar. You know, it's not just if you have back pain, right? That's what a lot of people think. There are some Simpsons episodes on that back in the day. It's just if your back hurts, go to the chiropractor. For sure, but that it's a lot more uses. We hope that's what you took from today, correct?
Yes.
Yeah.
And I always like to say too, if you've been in a car accident, come in and get checked. Even if you went to the hospital, you went to urgent care, and they're like, you're fine. They look for fractures, right? They look for internal bleeding. So to them, you are fine. But I can tell you 99% of the time, somebody's been in an accident, their neck is going to be straight. And now it's going to heal that way. So you're fine in terms of fractures or internal bleeding, but you're not fine in terms of structure.
Right.
You have to get the structure back. So even if you've been in a car accident, because 50 to 60% of people have chronic illness from an accident. And I have people all the time, they're like, well, I don't know if this is it, but like 5 years ago, I had an accident and now I've had A, B, or C since then. I'm like, yes, it's exactly probably when it started. So
right.
If you've recently been in one, you want to get it healed as quick as possible, is start getting the structure back, because structure controls function. So if you've been in an accident and the hospital said you're fine, still get in. Please still get in.
Yeah. Chiropractic medicine is one of the few examples of really getting to the root cause of health issues, because both metaphorically and literally you're getting to the nerve root.
Yeah.
Right? Which is like the ultimate root cause.
Yes.
So that's an incredible thing there. And I like that you share the case with IBS. Any other recent cases on your radar that really solidified why you do this every day?
Yeah, I had a patient last week. She told me that before she came, she would have to be at the ER for migraines routinely because all medications stopped working. And they were like, we don't know what else to do for you.
Right.
They continue to take this, and it wouldn't she wouldn't have them as often where she would have to go to the ER, but she was still having them. And so when we sat down for her re-exam, she's like, I haven't had a migraine in months. So that was rewarding to me, because, it's hard when you have a family you're trying to take care of. If you're at work and you're trying to function with a migraine that sends you to the ER. I mean, life is hard. And then you add that on top of it. So when she said that, I was like, that's so exciting.
Yeah.
And when you call in, Lindsay is my CA and manages everything for me. And once a week, what we do, as well as when we have our team meeting, we'll say, what's happening, a win for our patients.
Yeah.
And so that was a win, that she's no longer going to the ER for migraines. So we have a lot of those. And then today, the one with IBS has had it for years. So
that's incredible.
Yeah, I love it. I mean, because the patients, when they first went to, I'm like, well, do you have any concerns that you don't even think about chiropractic helping? And they're like, no, because again, they're thinking of bad back or bad neck. And then once their body starts healing, because a lot of people with acid reflux and GERD, chiropractic helps with that a lot.
Interesting.
That's a lot of people come in, but they don't even think.
What led you? Did you have family members that were chiropractors, or aunt, uncle, father, mom? How did you get into the field initially? How did it first hit your radar? Hey, why don't I consider this field?
What's so funny? We'd gone to chiropractors when we were younger, and then as I got I went to chiropractors because that's what I knew, right? If we were sick, we would go to the chiropractor and get adjusted. But I actually started my career in the mental health field. I was a psychotherapist for a long time, but when Prozac first came out, I was like, oh, this is great. It's going to cure all mental illness, right? Because
Yeah.
I was very medical minded.
Right.
And then when I saw that it was actually making people sicker and they were more symptomatic, their mental health was declining more, I was like,
Oh,
something's wrong with this. And then Effexor came out, Lexapro, and all these meds. And I was like, wow. I had told a patient, if you don't take your meds, you won't get out of the hospital. So I was like, oh, did I just say that? I was like, it's no longer about psychology, it's about pharmacology.
right.
And so it wasn't a model that I wanted for my own family. I can't go into it wholehearted and just say, take these meds and that's your answer for everything. Well, I was a supervisor of the program, and one of the therapists was bringing in their cases, and she said, I think I'm going to do something different. I was like, what? Because, I had been thinking in my heart, I can't do this anymore. What are you going to do?
Mm,
That I think I'm going to be a chiropractor. And that's like, I had my light bulb moment. I was like, that's it. That's it. I mean, we'd always gone when I was, I'd always believed in it. I knew my family got adjusted. Why did I never do that? So
yeah.
then in 2000, back to chiropractic school, which, trust me, my brain was not happy about that.
Yeah.
My brain's like, you're what? But we did it. And then in 2000, I was like, all right, we're going to do it. And so that's kind of what led me into it, because I see the body as a whole,
Right.
right? I knew if you remove some interference, which we call subluxation,
Hmm.
if you can remove that interference, then the body can heal and repair. That's
Incredible.
my story.
What a great answer. Yeah, you just had that light bulb moment and you knew.
Yeah.
So yeah, you
Yeah.
can't ignore that. Imagine how many practitioners actually ignore that same feeling that you had and they just keep doing it, right? That's scary.
Yeah.
It's sad, but
Yeah. It's sad. Yeah.
so yeah,
Yeah. I
that's
couldn't
incredible.
imagine doing it.
What advice
Yeah.
would you have, Dr. Zamora, for somebody that might be considering a field in chiropractic medicine? What would be your words of wisdom? How to get started? Maybe shadowing other chiropractors? What would you do if you were getting prepped for it now?
For sure. I'm going to say schools that I really love. Not that they're, Palmer is where chiropractic was founded, and Palm, which is where I went. That's a great school because you want a good philosophy along with it, right? Why you're doing what you do.
Yeah.
And then Life University in Georgia is a great one. Those are two great ones. Parker is in Texas as well. I mean, I like them as well. But I would find a good school with a good, solid philosophy, because chiropractic, they say, is art, science, and philosophy. You want all three of those things. And then, yeah, interview chiropractors. Hopefully, every chiropractor would be open to
Right.
you, like talking with them, go in, visit their office, and see how different chiropractors practice as well. We do corrective care, but there's a lot of other techniques that people use. Some are like more energetic, they use energy. But I would kind of see where you're more aligned. But don't be totally committed to that, because what I learned is going to a chiropractor was also, there was different techniques when I got to school. So
Right.
even though I had one idea in mind, I would go to all what resonates with you, but also be open to exploring other techniques in chiropractic college. But for sure, go to a good chiropractic college that has a good philosophy. That's number one.
Incredible. And then we'll finish off with
Yeah, and if there's ever anybody who
yeah.
would love to come shadow.
Okay, perfect. Yeah, I'll be passing that message along then. What's a good take home then if you're giving like an elevator pitch on somebody that's never tried chiropractic medicine, and customers, they're listening to us right now, Dr. Zamora, as they're shopping here in Healthy Habit, looking for pain supplements or, like you mentioned, anxiety, depression. What would be your elevator pitch recap on why someone should consider seeing you, Dr. Zamora, at the clinic?
Yeah, one, because it's always nice to have x-rays so you have a baseline, right? So then you can see, like next year, if you take an x-ray, how rapidly is my spine degenerating, or is it maintaining its integrity? So one, I would always start with x-rays so you have a baseline of where you were in 2024, right? And then just consider chiropractic for more than just aches and pains. It's about overall wellness, and find someone who looks at that as well. Find out where your spine is. And then gentle eye adjust babies. I have patients who are 90 years old. I adjust them. It's safe and effective for everybody.
Oh my goodness, that's amazing. I'm going to come see you soon too, and we're going to keep sending people your way, Dr. Zamora. Thank you for your time for episode 104. We always appreciate you.
Yes, I'm glad. And I send people there too.
Thank you.
Because I love you guys. And
Oh, we
I
appreciate
believe you're
that.
doing, because you care about your community as well. So I love it.
Thank you so much, and I can't wait to talk to you again in a couple weeks here for our chiropractic check-in with Dr. Zamora.